Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention, and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often the steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan and then conducting usability testing, analyzing results, and making adjustments. These functions are covered in modules 2 and 3 in this series. Part 2 is piloting and includes determining the approach and developing a plan, identifying and recruiting sites, and conducting the pilot, which are covered in modules 4, 5, and 6 in this series. And then in this module, we will discuss assessing results, reviewing progress, and then making adjustments. Before moving on to Part 3, staging and scaling up, which includes developing and refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. Let's get started. Why do teams assess results of the pilot, review progress, and make adjustments? Based on the data collected and analyzed, teams should assess results of both the intervention and the implementation process, and use the findings to inform recommendations on whether to move forward with the intervention on a larger scale and how. Teams need to review key findings with leadership and other stakeholders to get their input and to address critical questions about whether and how to proceed with staging and scaling up the intervention. Throughout the pilot testing, teams should be identifying potential changes needed in strategies, components or related activities, program champions for further implementation, and plans for staging and scaling up. These activities will help the team set a strong foundation for a successful, larger-scale implementation effort. While assessing results, reviewing progress, and making adjustments are described as the final essential function for piloting, these activities can be ongoing throughout the pilot period and revisited at the end. In particular, teams will want to pay attention to findings related to the ability of pilot sites to meet expectations and achieve their objectives, what worked and should be continued, what didn't work and under what conditions, adaptations that may be needed to the intervention or the implementation plan for wide-scale implementation, current or additional supports or capacity building that may be needed for scaling up, for example, training, coaching, changes to practice profiles, information management system design changes, or additional funding. And benefits or incentives that can be leveraged to promote buy-in from new implementation sites. While small-scale pilot results on short-term outcomes should be viewed as preliminary, they can be revealing. Teams should prepare and discuss summaries of key findings with leadership and other stakeholders. They will want to anticipate and address decision makers' critical questions to inform decisions about whether and how to proceed with staging and scaling up the intervention. In addition, teams should discuss progress and findings with stakeholders, including staff, community members, and service partners. It is important to keep pilot site participants and future sites informed of pilot findings. Be sure to share successes to help strengthen motivation, engagement, and momentum. Finally, teams may want to discuss feedback and ideas for adaptation with program developers or other subject matter experts. These experts may be able to offer additional insights into making appropriate changes and what has been effective elsewhere. They also can help teams ensure that adaptations still maintain the integrity of an intervention's core components. When a team makes adjustments to an evidence-supported intervention, they may risk not maintaining fidelity and not achieving expected outcomes. Teams will need to make decisions based on the pilot findings, leadership and decision makers, as well as staff, partners, and community members and program experts to determine what, if any, adjustments are needed and next steps. This may include potential changes to implementation strategies, recommended adjustments to the intervention's core components or related activities as appropriate while preserving integrity and effectiveness, new initiative champions that can support implementation and promote buy-in, and then plans for staging and scaling up. Once the pilot is complete and the team is confident that the intervention can work as intended, they have made any adjustments as needed, the team will begin planning the staging and scaling up of the intervention on a larger scale. Teams should also revisit their working implementation plan based on what they've learned during the pilot and make any changes as needed. What helps teams to assess results, review progress, and make adjustments? As a team, consider the following questions. What indicators suggest that piloting is going as planned? Have the pilot objectives been met? What do data and findings suggest about whether or not to stage and scale up the intervention? What do data and findings suggest about needed modifications before staging and scaling up? What are the key messages for stakeholders? Answering these questions as a team will support decision-making on how to move forward from pilot testing into staging or scaling up the intervention. Let's check in with an example. To strengthen implementation of a new child welfare practice model, Washington State conducted a pilot of 2 core components, training and coaching, prior to a statewide rollout. The 3 pilot sites represented small, medium, and large populations. The implementation team held pilot planning meetings with child welfare staff at each site prior to beginning training and coaching. These meetings were used to present an overview of the pilot, identify office strengths and challenges, discuss training and coaching plans, introduce plans for quality assurance and evaluation, and answer staff questions. The piloting plan schedule was designed to maximize the impact of training and coaching. The plan consisted of a 7-week training cycle that included a blend of classroom training and practice application training, and one-on-one work with a practice model coach for field staff and supervisors. As part of the pilot, the team used fidelity tools and feedback loops to develop individualized learning plans for staff. The pilot included evaluation with a university partner that included qualitative and quantitative feedback that helped the team to modify the training curriculum and the training and coaching processes and tools that were used in the testing period. Then the team followed up with another planning meeting with sites shortly after the conclusion of pilot training to review feedback, evaluation findings, and next steps. After a 3-month pilot period, including training and analysis of evaluation findings, the state was better prepared for launching the practice model in other locations statewide. Let's take a moment to check in on what you've learned about assessing results, reviewing progress, and making adjustments. Why do teams assess results, review progress, and make adjustments? To determine whether to move forward and how, to keep stakeholders informed and gather their input, and to identify changes needed to prepare for larger scale implementation. How do teams assess results, review progress, and make adjustments? By looking for what is working, not working, and what may be needed for staging and scaling up, then discussing progress and potential adjustments with key stakeholder groups before making plans for staging and scaling up. What can help teams assess results, review progress, and make adjustments? Looking at indicators of success and whether objectives have been met, determining what the data and findings suggest about scaling up or modifications, and identifying key messages for stakeholders. Now take this step further by reviewing the reflection questions for assess results, review progress, and make adjustments in your intervention testing, piloting, and staging workbook to connect what you've learned to your own experience. Up next is part 3 of the intervention testing, piloting, and staging brief, staging and scaling up, beginning with develop or refine plans for staging the intervention and scaling up, the first essential function for this part of the brief and the 8th module in this series.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.